Hello friends, today's topic for discussion will be human herpes virus. There are a total of 8 major human herpes virus, of which I will be discussing the most important ones in this session. So the first is human herpes virus 1 and 2, which is nothing but the herpes simplex virus 1 and 2, which are structurally similar but different antigenically. Initial exposure of an individual to the primary infection has an incubation period over 3 to 9 days. Following this, the virus is taken up by the sensory nerves and are transported to the autonomic ganglia, where the virus remains in the latent state. The latent infection gets reactivated into secondary or recurrent herpes simplex infection under conditions such as old age, UV light, physical or emotional stress, heat, cold, pregnancy, allergy and trauma, etc. The primary infection includes acute herpetic gingivostomatitis, prodromal syndrome such as fever, nausea, anorexia, sore mouth, and pharyngotonsillitis. Recurrent infection that occurs on the fingers because of touching an infected patient is the herpetic whitlow, and herpes on the lips called as the herpes labialis. Histopathology shows presence of Zang cells, which is quite typical of herpes simplex infection. Moving over to human herpes virus 3, the Varicella zoster virus causes chicken pox in childhood, and the incubation period ranges between 10 to 21 days. And this spreads through air droplets and direct contact with the active lesion. This then later on reactivates in old age and causes herpes zoster, that is your shingles. The prodromal symptoms for chickenpox includes nausea, vomiting, fever, malaise, pharyngitis, and there is a typical dewdrop on rose petal appearance of these lesions. In the oral mucosa, you can expect white opaque vesicles which rupture to form 1 to 3 mm size of ulcerations. Shingles starts as deep aching and burning pain sensation, and there are zosteriform lesions in the thoracic or the lumbar region which lasts up to 2 to 4 days, and this takes about 2 to 4 weeks for healing. As a complication, it leads to post-herpetic neuralgia and paralysis in case of immunocompromised patients. The characteristic feature of shingles is that it does not cross the midline. There is involvement of the fifth cranial nerve, that is your trigeminal nerve, and in the oral mucosa you can expect 1 to 5 ulcers which break and coalesce together to form larger ulcers, and it takes about 10 to 14 days for the healing. Coming to human herpes virus 4, which is the Epstein Barr virus, this leads to infectious mononucleosis. The primary mode of spread is through contaminated saliva, and hence it is also called the Kissing's disease. The classical feature could be a very high fever of 104 degrees for up to 2 to 14 days. It also includes lymphadenopathy, pharyngitis, hepatosplenomegaly, rhinitis, and cough. In the oral mucosa, petechiae can be seen on the hard and the soft palate for up to 1 to 2 days. Coming to human herpes 5, which is your Cytomegalovirus, most commonly seen in immunocompromised patients, and this leads to vascular inflammation, vascular occlusion, and end organ damage. The primary transmission is through intimate contact and blood products. Clinical features includes fever, lymphadenopathy, and splenomegaly, and there can be complications such as meningoencephalitis, myocarditis, and thrombocytopenia. In the oral mucosa, there can be a single large necrotic ulcer which can be painful, lasting up to weeks to months. On the histopathology, you can expect multinucleated giant cells giving a owl eye appearance. So friends, I hope you have noticed that I have not taken a detailed lecture, rather focused only on the MCQs. In case you have any doubts or you want me to take any particular topic in special, then do mention in the comment section below and you can expect future videos. Until then, take care. Bye-bye.